Medicine doctor from Feel Good Functional Medicine. If you're interested in learning what are those big skincare mistakes you don't want to make, listen on because look, and I've got a fly flying around me. Oh my gosh. That's what happens when you're in Mexico. Um, I was talking with a plastic surgeon and learned some things that I wanted to share with you about the big mistakes that they see. Of course, this is part of my Energy for Life holistic healing community. This is part of a course on skincare and anti-aging skincare. And I think it's important to recognize there's lots of ways to treat your skin, and there's some ways to not treat your skin. And so this is all part of that ongoing series. So here we go. What are the top skincare mistakes that people make? Okay, number one, inconsistent skincare routine. I have been guilty of this. So what we want to do is do something regularly. If you're truly interested in maintaining what you got going on, right? You do need to, it actually is helpful to cleanse. And I have not always cleansed my skin. I just started to realize this now that I understand all the toxins that we are exposed to through the air that we're out in all of the time, pollution and that sort of stuff. It really affects the health of your skin. So not doing something consistently. And it's a good time to mention the fact that foaming cleansers, who knew? Foaming cleansers can be harsh on the skin. So you really want something that's not foaming up because it tends to be too abrasive. I didn't know that till this conversation. But the other thing is sunscreen is one of those things that has 100% proven to be helpful in avoiding sun damage and preventing wrinkles. I think that what we're seeing is this shift in the tide of some of the ingredients in sunscreen need to be looked at pretty closely. So I suggest you do is follow the Environmental Working Group, EWG.org, their recommendations on what's really safe for sunscreen. The EU has reduced the amount of some of those sunscreen things that are in higher amounts in the United States. So it's just, I think going to the EWG, they have a skincare product guide. And anytime I'm putting a chemical on my face or on my body, I'm looking at the EWG.org Skin Deep guide to make sure it's not toxic to me, because some cosmetics are not as closely scrutinized in terms of ingredients. And especially if they come from another country, you might have lead in or lead in like cosmetics and that sort of thing. So check out that EWG Skin Deep guide. That'll be helpful as you're trying to pick things like sunscreens. But sunscreens are one way that you can prevent that visible aging signs. And I like to cover, right? Hat, long sleeves. I'm one of those weird people at the beach. I'm all covered up. Me and my husband, we're both like weirdos. But it's a good way, right? Because then you don't have to put as much chemical on your skin, especially when you don't know what's going to be proven to be cancer causing. Okay, the next one, this is something I just learned last week. The danger of popping pimples. Did you guys know, especially with older skin? I had a pimple come up and I popped it, right? Because as I am prone to do. And as I was thinking about it, I'm like, this is going against the advice, but I'm gonna do it and just see. And I got worsened redness. And if anybody's ever popped a pimple and had like a big old mountain of redness on their face, will know that there's a problem. It can spread bacteria. It can lead to scarring, and it can worsen a skin condition. So you really want to see if you can find other ways through specific skincare. If acne is an issue for you, speaking to a dermatologist and getting a great routine down, that's going to help that. Okay. So let's go on to the things that this is something I actually didn't know about. Neglecting the neck, right? So many of us will, maybe take care of our face, put moisture on our face, but what about our neck? You cannot ignore your neck, because as goes the neck, so goes the face. They are connected. And when I talk a little bit about the surgeries, touch on that. If you do something to your face, you have to do it to your neck. Like if people are getting like lips, it's important that you don't just lift your neck, right? It's all connected. And that was one thing that they were strongly saying, is that if you're going to, sort of pull it all up, we're going to do surgery, because it looks weird to have like a facelift, and then have your neck look really old. Okay, but don't neglect your neck when you're putting on your skincare too. Really important. Now, the other thing is thinking that an expensive product is better because it's expensive. You want to make sure that your skincare, if you're trying to do the anti-aging thing and keep your protective facial skin, that you're looking for active ingredients. Ingredients like vitamin C, hyaluronic acid, retinol have been shown to be helpful for prevention of wrinkles. Now, with the caveat there, and I'm going to speak to retinol specifically, because over the years, there's tons of evidence to say, tretinoin, retin A, you may have heard of it, is helpful for reducing wrinkles, right? I mean, that's unequivocal. It is true. However, just in the not too distant past, a paper came out that, albeit not as well fleshed out, I feel like that pun, not as well fleshed out as one would like, but they were trying to see if retin A or tretinoin would reduce the risk of some skin cancers, right? So they're going to do this long-term study, and they had to stop it early because the people who were using the tretinoin, they had a statistically significant increase in all-cause mortality. It's like, what's going on there? So, I mean, if we're talking about, the prescription strength retinoin, or retin A, commonly used by people to minimize wrinkles, this is a wrinkle in the research, and I don't really know what to make of it yet. But when people have looked at that study, they said, well, they didn't control well enough for smoking. And we know that smoking combined with tretinoin can place you at increased risk of problems like with your lungs, things like that. So if you're a smoker, I don't think it's a good idea. We have to wait for more research on that. And so it's important that if you do use retin A, this is another thing he mentioned, that people who are using retin A for wrinkles, they tend to give up too early. The trick with retin A is basically it does a little bit of damage, so you have fresh skin coming up, right? And that's how it works. And you will have some skin irritation, 100%. That's going to happen. So this trick is to start really slow, like low dose, 0.025, maybe a couple times a week. And don't just crank it up. More is not better. Oh my gosh, I'm so embarrassed about this fly. There's two of them. So you want to start really slow, crank it up slowly. And sometimes less is more with these types of things. But know that it is pretty remarkable for its skin rejuvenation properties. And if you're really serious about reducing the wrinkles, you may need to persevere because of that specific thing. Okay, let's talk about some things that I don't have personal experience with, but I think it's important to note. You may see a lot of the stars that you loved when you were a teenager in your 20s, and now you're 50s like me, and you look at them you go, dang, they look different. They look different, and maybe not as good as they want to look. And a lot of that's because fillers are not great for lifting a face. The misuse of excessive fillers will lead to your skin, your face actually sagging more and can create deformity. So I'm not a super big fan of fillers. I think if you're going to try and fill your face, one thing you should consider as part of my skincare course is doing facial yoga and exercises to help strengthen and bulk the facial muscles, because those will help support the skin. It for sure can't hurt you. So fillers, probably you need to be careful there and make sure the person that you are going to have put your fillers in really knows what they're doing and has done it a long time. I mean, this is the kind of thing truly I would be going, if I were going to do fillers or something like that, I would be going to a dermatologist who had lots of experience And the other thing that was mentioned is that thread lifting, that thread lifting is where they put threads in and they pull up the skin. That really can be associated with some complications and nerve issues, and it's not a reliable anti-aging solution. So I don't think that thread lifting is these days considered one of the primary ways to improve the complexion, although you still see it out there. And I think this goes along with trends. This is something they said, is that following social media trends can sometimes be dangerous. You want to have, and not good, and it can make you actually have problems. You want to have someone guide you that knows about these things, a dermatologist preferably. They know all things skin, so I would be looking for a good dermatologist. We want to make sure we're setting nice, realistic expectations, and also think about, if you do decide to have some kind of procedure done, like pulling stuff up, a facelift or something like that. One thing they said was, you don't really want to pull things to the side. And then probably that's because the kind of procedure he did took things up rather than pulling to the side. And you want to do something to both face and neck, if possible, rather than one or the other, so you look consistent. And then realize that you have to set realistic expectations for whatever you're going to do. And finally, I feel like this is a most important thing. As you get older, let's start to think about those smile lines, those crinkle lines around our eyes as wisdom lines. All right. So I want to embrace, as I move into my senior years, as somebody who appreciates all the things that I've gone through. And this is our body's show. And, I can embrace my wrinkles and feel good about it. I mean, that's me. And taking care of my skin, I could still do that too. Take care of my skin and minimize sun damage. Also, we want to minimize our risk of getting cancer of the face, right? So that's why, photo protection is so important. Get you a broad brim hat and you go out there and you do you guys. So this is part of my skincare course, which people who are in the Energy for Life, holistic healing and anti-aging community have access to. And if you're interested at all in finding out more about like this, how you can do brain healing, how you can heal from complex medical illness, all with free access, you could reach out to me by sending me an email, clinic@feelgoodfunctionalmed.com. Write it down. Actually, it ought to be in the description below. And for the moment, the price of admission is just becoming a customer or a brand partner with me using the phototherapy patches that I recommend to people, which I feel like is why I am looking, and people have told me that I'm looking younger than I did a few years ago. And I feel like it's the phototherapy patches that I'm using that have made that difference, and then the skincare that goes with it. So it seems like it's serving me pretty well. And there's a link below where you can find out more about the skincare system. Is called Alavita, and there's a patch that goes with it, a phototherapy patch. The X39 also is a phototherapy patch that we see a lot of impressive things happening in people's skin, but they are not made to diagnose, treat any medical condition. And I see that you have not been able to hear me this whole time. Is that right? Oh, curses. All right. Well, that's no good. I'll have to do this again if that's the case. I'll go check it out. All right, you guys. Have a great day.